Map is compiled using confirmed cases of COVID-19 reported by local health departments. We don't know how many patients who haven't been tested show up at hospitals with symptoms of the disease. Those numbers would indicate how busy our ERs and ICUs really are right now. Plus, NBC News reports it's also an indicator of how many people in various communities actually have the virus. KXAN investigator Erin Cargile has been trying to get that data for Central Texas.
Michelle Lee Carter's family says she died from COVID-19 after 7 days in the ICU at a Round Rock hospital.
She drove herself to the emergency room. She told me, they insist I go and I can't breathe. And so they immediately got her into an isolated room in the ER and then quickly tested her. And then the results came back the next day, basically right after she was transferred to the ICU.
She told her daughters the week prior, doctors she saw through telemedicine appointments thought she just had the flu. That means about a week went by when Carter had the coronavirus, but nobody knew. And what about people who get a mild case or show no symptoms, never get tested, and then recover?
Because there are certainly a lot of positive cases that are not officially confirmed.
Wednesday, Austin Mayor Steve Adler admitted in a one-on-one interview with KXAN the numbers being put out daily by the state and county are not telling the full story.
As we get more tests, we're going to be checking more and more people, so we would expect the positive number to go up.
A number that's also proving to be impossible to get here in Central Texas. How many people are being admitted to local hospitals like this one with COVID-19 symptoms? Not just patients who test positive. Those numbers were provided in a report in the Houston area this week, and according to NBC News, proved there was a big jump in patients showing up to hospitals with signs of the virus, which was not reflected in the area's total cases, leading infectious disease experts to believe most coronavirus cases have gone undetected in America's fourth biggest city. When we asked Mayor Adler about getting those numbers, he said it's data the city and county is about to start tracking.
We're going to start looking at that number every day because the hospitalization number is independent of the number of people that we test. And it's a good way for us to track the virus. So we'll be getting that information out as well.
Erin Cargile, KXAN, investigates.
Erin identified the Austin equivalent of the group in Houston that should be tracking hospital admittance numbers. It's not responded to our request. We will keep checking.